To the 2 cycles of IVF, you have the registration and consultation, the basic fertility investigation, the fresh or frozen embryo transfer, embryo freezing for 3 months, and then controlled ovarian stimulation with a standard dose of 150 IU gonadotropin for 12 days. That is what is contained in this program. Now, for the basic fertility investigation, for us, we have 3 packages. We have the basic, we have the standard, and then we have the comprehensive. Now, what is contained in the basic is the blood group and genotype for both couples, serology test, which is to exclude any infection, hepatitis B and C, syphilis, and HIV for both couples, and seminal fluid analysis. That is the basic test that is required for couples that are coming in for in vitro fertilization. So that is covered in this package. Now, when we say fresh or frozen embryo transfer, there are some patients who will end up having a fresh transfer, and there are other patients who would end up having a frozen embryo transfer. So both of them are covered. Now, for self patients who would have embryos, excess embryos for freezing, or we would decide to do an off-freeze protocol for them, meaning that we generate embryos and it is not safe, or it is not, the success rate from doing a fresh transfer will not be good because of high levels of progesterone, or if they have ovarian hyperstimulation, we will decide to freeze all the embryos and do a frozen transfer in the next cycle. So freezing is covered in this program, and then storage for 3 months. After that, then the additional cost would apply. Now, this program also covers medications. For patients who are coming who are recipients going for an egg donation program, all your medications are covered. For self patients that will be on stimulation, the down-regulating agent is covered. All other medications are covered. Your gonadotropin is covered up to with a standard dose of 150 for 12 days. If, however, we need to increase your dose because of certain factors, then what you do is to just pay for that additional dose that has been added. All right? Now, what are not covered in this program? The investigations that are not covered are the hormonal tests, the AMH, FSH, LH, estrogen, thyroid stimulating hormone, prolactin, progesterone, all of those hormonal tests that will be required for some category of patients, they are not covered. And so if we need to do those hormonal tests, then you need to make an additional payment. We will get to the cost for each of these additional payments very shortly. Then, of course, ancillary tests also are not covered. There are some patients who may require them to have these tests done. All right, so if it is required that you do this test, then you have to make the additional payment. All right, HSG, saline hysterogram, egg donation program, sperm donation, intracytoplasmic sperm injection, and sperm freezing. All of these are not covered in this program. You would realize that the treatment of infertility through the ART technology is a very broad subject. So not one treatment fits all couple. When you come in for your evaluation, based on the evaluation investigation that is done, we will discuss the different treatment options. And based on the option that we both agree will be the best for you, we'll decide whether you need to make any additional payments. For those of you who don't know what intracytoplasmic sperm injection means, it means that you take the sperm and you inject into the egg. This is particularly done for patients with very poor sperm parameters, particularly the count and the motility, specifically the motility. All right, so these are not So, all right, so additional gonadotrophin beyond the standard dose of 150 for 12 days, I've mentioned that. Then surgical procedures like hysteroscopy, laparoscopy, hydrolysis, cervical dilatation, MVA, mock embryo transfer under anesthesia, myomectomy, or cervical circlage. Now, there are certain patients who we may need to carry out some surgical procedures on before they embark upon their program. Majority will not require this, but for us at JOJE Abebe Fertility Center, we are very thorough. We want to make sure that at the very first attempt, you achieve success. So we'll make sure that you are properly prepared. And if you need to go through any of these surgical procedure, that is not covered in the program, in the 500 that you've paid. So you need to make an additional payment. Supplements that are needed for male or female to improve the sperm and egg quality, it's not covered. If you need to do repeat semen fluid analysis because of the fact that the initial semen parameters were poor and you've been on medication and you need to repeat your semen analysis, that you will need to pay for. And then storage of the embryo or sperm after 3 months. Like I said before, embryo freezing and storage for 3 months is covered under the program. After 3 months, you need to pay for storage, okay? Sperm freezing is not covered under the program, and that you will need to pay for. Now, I quickly want to just dwell on what 1 cycle of IVF treatment represents so that we have a very clear understanding. Under this program, we would say that you have completed 1 cycle of IVF treatment when you have either a fresh embryo transfer or you've had a frozen embryo transfer, or you have gone through a program where we're able to generate embryos and we froze all. That will represent 1 cycle. Or when, for some patients, they've gone through a program and they had very poor response, and so the program had to be canceled. That again will be considered as 1 cycle, and that is why it will be very important when we are choosing options that we are very, very particular about options that give you the best chance of success. What do I mean by that? A woman who comes to me and she's 45 years old and she insists on using her eggs, when I know full well that the chances of getting eggs from that woman is very, very low. If she insists, we will give her that option. But if while we are doing the stimulation, there's no response and we had to cancel, that means 1 program, 1 cycle is gone. It's also possible for us to have very poor quality or no embryo generated, and so there will be no embryo transfer. These are things that happen during the course of IVF. Usually, it could happen, not commonly, but it's something that could happen, okay, because of several factors. If that happens, that is also considered as 1 cycle. Now, if you, this is for recipients or those who are going through a donor program, you've inseminated the donor eggs, but have very poor quality or no embryos generated because of, again, certain other factors like the sperm factor mainly, then that will be considered as a cycle. And then, of course, if we had to cancel a program after we have gone through because of fluid, of endometrial fluid, once we find that there's fluid in the endometrium, we would not go ahead to do a transfer. We would rather cancel that program. But as you will find out, that program, that cycle is not completely lost for patients who have endometrial fluid. Now, what are the additional costs for this that you may need to make? Okay. For the investigations, the additional cost will range for between 50 and 75. And this is basically for the hormonal test. And this usually will be for patients who are using their eggs and we need to determine their ovarian reserve. So we have to do an AMH, FSH, LH, all right, do the progesterone. That is usually done on the day of trigger to find out if the progesterone levels are high or not. There are other hormonal tests that are done, particularly for the male, if there is very low semen parameters. We want to find out if there's low testosterone, if the DHEA is low. All of these tests are tests that are usually that may be required, and that is the cost. Now, for the ancillary tests, like I said before, there are patients who may require this, an advanced woman who is carrying pregnancy for the first time. We want to be sure that she's fit. So in addition to the tests that are required for IVF, we also want to be sure that her organs, her kidneys, liver, and are all functioning well. She's not diabetic. We've done the swabs, we've done the pap smear. We use that as an opportunity to screen for cervical cancer. If all of these tests are going to be done, that is the cost. HSG sometimes may be required if we're suspecting adhesions, all right? And then saline hysterogram also is something that we do if we are suspecting that there could probably be a polyp or a submucous fibroid in the endometrium. It's a procedure we do just to be sure that everything is okay in the endometrium. So these are all additional tests that is required. It's not compulsory for all patients. Please, I need you to note this. Okay? Some patients, most patients will not require this. Some patients may require this. And this is why we have come out to state very clearly what the additional cost could be. For additional cost for gonadotrophins, you have between 50 and 250. And this is because of the medication. Some patients may require double the medications that we already have stated. And so for patients who may be requiring these, and that is the additional cost. Now, for patients who will require an egg donation program to achieve a successful outcome, the cost is 200,000 per cycle. And so what that means that if you pay 200,000 and you've gone through a cycle and you are successful, that is all you're paying. However, if you are not successful in that first cycle, when you're coming back for the second cycle, the only amount you are required to pay is 200,000. Now, for patients who will be requiring a sperm donation program, make an additional payment of 100,000 for a sperm donor. For patients who will require intracytoplasmic sperm injection, like I explained before, patients with very poor sperm parameters, they will need to make an additional payment of 100,000. For patients who will require freezing, now there are some patients who are not based in the country, who are not based in Abuja, and they don't have the time to come in. All they want to do is to just come in once. During the period of their test, they may elect to freeze their sperm. If we're going to be freezing your sperm, it's 100,000 per sample per freeze. Now, for sperm and embryo storage, this is for storage. Typically, like we said before, the embryo freezing and storage for 3 months is covered under the program. After 3 months, you are required to pay 10,000 per month for storage. Meaning that if we take a patient through this program and she generates more than enough embryos, we will not transfer all. We will transfer the required. We will freeze the remaining. And after 3 months, you'll be required to pay 10,000 a month or 120,000 a year. So these are for the surgical procedures. These are the amounts that may be required. If you require diagnostic hysteroscopy, that is the amount that is there. If you require a therapeutic hysteroscopy, meaning that we've gone in and then we have found that you have a polyp or you have a fibroid that needs to be removed, or you have adhesions that needs to be taken care of, that will be done. So depending on what is seen and what is done will determine what the cost would be for therapeutic hysteroscopy. For laparoscopy, the cost is 200,000. Now for myomectomy, the cost is 800,000, and that is a discounted rate. Now, for all of these surgical procedures, if you decide to do them somewhere else, it's okay. There is no problem. All right, as long as it is done properly and you do it in a center where we are sure that it's properly done. Okay, so it's not compulsory that you must do any of these surgical procedures with us. If you can find it cheaper somewhere else, please, by all means, we can allow that. So for mock embryo transfer under anesthesia, there are certain patients who may require the mock embryo transfer, which is done before the main transfer, to be done under anesthesia. Typically, the mock embryo transfer is done in the office. It's a clinic procedure. However, there are certain situations when the service is blocked, is stenosed, and you're not able to take your catheter through. And when you try to do the maneuver in the office, it can be very, very painful. So for patients who need to have a cervical dilatation done under anesthesia, that is the cost that will be required. Again, for cervical cerclage after pregnancy, 12, 13 weeks, that is the cost. For patients who will require supplements, either the male or the female, to improve the egg or sperm quality, then that is the cost. And then after you have gotten pregnant, there's a luteal support program for 7 weeks to support the pregnancy. You'll be given medications, injections, inserts, and oral medications. That the cost is 250,000. So I believe that we now understand what the program is all about. All right, in terms of the costing, there are so many patients who have gone through and they were worried that they have to go through pay all of those additional costs. No, it is actually possible that you can go through that program, and the only additional cost that you may pay may just be the additional cost for hormonal tests. It's also possible that you can go through that program, and the only additional cost you're paying is if you are doing an egg donation program, you pay 200,000 for your egg donation program and you get pregnant. Okay, I will present some scenarios, okay, of possible treatment scenarios so that you will understand what the cost implications would look like. So we'll quickly go through the step-by-step process. Okay, many of you have already registered on the foundation's website. That is the first step. All registration must be online. Even if you come to the office, we will still need you to go online and register. So that is where this process starts, registration online. And like we have encouraged those who have called us, please ensure that you go through the terms and conditions. Very important. Before you register, make sure you go through the terms and conditions and you are convinced that it's okay with you. Once you have gone through the terms and conditions and you're registered and you submit your registration, you will receive an automatic email from us confirming your registration. Okay? Now you will get a call from us. There's a slight adjustment which we made after we produced this slide. You will get a call from us just to confirm that you indeed went through the terms and conditions before you did your registration. And if you have not done that, you will be advised to go back, go through the terms and conditions, understand them before you proceed. Once that has been done, we will send you a mail that contains the bank details, all right, where you will make your payment, the 500,000. And then you also will include the account, the phone number with which you will send evidence of payment. Once that has been done and you've sent evidence of payment, you will get a response via email confirming payment, and within 1 week of confirmation of payment, you will receive a call from the JOJE Abebe Fertility Center scheduling you for your first consultation after you have done your registration. Now, for patients who are based in Abuja, we will have a physical consultation. If they elect to have an online consultation, that is also available. But for patients who are out of town, those who are not based in Abuja, it will be an online consultation. Now, after that has been done, you will now be scheduled for a fertility investigation, the result review, and then the treatment option discussion. These are all put together. Usually this should take about 2 to 3 days, particularly for patients who are not based in Abuja. You will need to, you'll be given an appointment to come for this. This will be the very first time you'll be having contact with us physically. All right, it's very important for us that we take you through this process ourselves. Some may say, oh, what if I do my investigations in a lab very close to where, a lab in my state, and I send you the results? Will that not suffice? That may suffice, but we've had challenges. Okay, that is why we insist that we do our investigations ourselves. For example, particularly for patients who are going for a recipient program, an egg donation program, and you tell us that your blood group is B positive, and then we use that to match your donor, only to discover that you are A. That could become a challenge. We will not be held responsible. So that is why we insist that you will come for your fertility education. The basic is already covered in the programs anyways. We will discuss the results, and then we would discuss also the treatment options that are available, and then we will pick the best treatment option that will give you the best chance of success. Also, at that event, you may also have a mock embryo transfer done, okay, and then sign the relevant consent forms. That is why it is important that this particular activity takes place in our center. It's not just the fertility investigation, okay? So for those who are out of town, you'll be spending about 2 to 3 days, okay? And after that, you will go back, and then we will send you a mail specifying your date of treatment, the specific treatment program that you'll be going through. Any additional costs that may be required will be stated, and then if there's any specific pre-IVF treatment that may be required, we will also state it. These are all the things that will come out from the fertility evaluation that we would have carried out. There are some patients that may require a mammectomy, removal of fibroids. There are some patients that may require hysteroscopy to ensure that everything is fine. Some patients may require to be on supplements, but for the husbands, to be on supplements for about 3 to 6 months in preparation. Some may need to lose weight, some may need to be on supplements to improve egg quality. So all of these things are things that we will determine, and then we will state on the mail that will be sent to you. And then after we have done that, typically once it's getting close to your treatment program, we'll be in touch with you to find out how you're doing, particularly for those who will be on pre-IVF treatment programs. Your program will be planned at least a month before the start of the program. You will have the program sent to you. You will get a call taking you through the program. And then for those who are not in Abuja, when they come for that investigation result review, they would be given their medications to go home with. All right, so that when it is time for your program, all that you'll be told is how to start and when to start your medication. Now, what we are also very concerned about patients who are not based in Abuja, because I know that majority of patients will be coming from out of town. The promise is that we're going to try and make it as convenient as possible for those who are not in Abuja, so that the 2 trips you will need to make, you will be spending a limited but very impactful period to ensure your treatment success. Okay, the execution of the treatment plan would get in touch with you, the IVF team, the nurses and the doctors, your regular scan schedules for ovarian, controlled ovarian stimulation and endometrial regulation. Now, patients will be given appointments for their injections and other procedures. Now, for patients who are not based in Abuja, the plan is this. We are going to run this program in two phases. The program will start in your state. Basically, what we need from you is to have a center where you can do a scan. The video of the scan will be sent to us for interpretation, and then we will instruct you on what to do. That way, the amount of time that is required for you to be in Abuja will be reduced significantly, so that it is only when it is critically important for you to be in Abuja, that is when you'll be in Abuja. With this, it will reduce the amount of time you need to be out of work. It will reduce the cost. We're also going to be providing accommodation for patients who are going to be coming. Again, it's not part of the 500, okay? You need to pay for the accommodation, but it will be something that should be affordable, all right? And then the end stage of treatment is an embryo transfer, which again, I said could be fresh or frozen, depending on the program that you are doing. So that is the step that we're going to be taking to execute the treatment programs for patients who have registered. Terms and conditions. These terms and conditions basically have gone through them before, but we decided to put it here so that you go through it one by one and have an understanding that you agree to these terms and conditions. This program, the 500 you're paying is not refundable. Some of you may ask, why is it not refundable? It's not refundable because we want to ensure a seamless program. We've had events in the past where people will make payment and they say, oh, please, I want refund, I have a change of mind. All right, because of the nature of this program, once you make your payment, it is not refundable. So that is why you need to be very, very sure that you want to go through with this program. And then we've stated here that once you make your payment, the program itself will start immediately. Like I said before, within 1 week, you'll be called to start your registration and consultation. But the main program itself will start at least 3 to 6 months after you have made payment. It's 3 to 6 months, okay? 3 to 6 months. Now, some may ask, why am I not starting immediately? I want to get pregnant immediately. The reason why we have done this is because we want to be able to offer quality service for which we are known. The service we are offering under this platform is not going to be different from the service we are offering for patients who come in and pay our normal fee. So if you are on this platform or you're paying our normal fee, it's going to be the same service. But we realize that more people are going to be coming on this platform. And so to be able to handle and offer excellent service, we need to be able to plan. And that is why we have given this time lag. Also, there are patients who are also going to be on pre-IVF treatment. We need time for them, all right? We've discovered that a lot of patients, when they come in, they're in a hurry to want to get pregnant. Some patients may require supplement for up to 6 months, but they don't have that time, that patience to be able to take it. So we have structured this program in such a way that we are offering you the best, okay? The payment of 500 covers registration and consultation, basic, and 2 cycles of IVF treatment. So these terms and conditions, they are all on the website, okay? I've gone through this before, so I don't want to bore us with the details, but these are all the terms and conditions which we have. I've gone through all of these before. It's important that you go through them. Like I said, it's only when it is required, that is when you would need to make all of these additional payments, okay? Let me just say here that, okay, there are some other terms and conditions that I did not I did not talk about. Now, although it is expected for a cycle of treatment to end with an embryo transfer, sometimes the cycle, okay, I think I've mentioned that. We may let to freeze all embryos where feasible because of high progesterone levels, HSS, I've mentioned that. Now, what is the success rate? Because we've had that feedback. What is the success rate? We are not guaranteeing you 100%. Based on our current success rate, average success rate of 43.7%, we have come up with a cumulative clinical pregnancy rate of 70%. So by the time we are trusting God that out of the 10,000 couples that will go through this program, at least 70% of them will come out successful. Now, for a patient who has embryos that are frozen, that got pregnant and has delivered, if you're coming back to have a frozen embryo transfer, the cost would be $380,000. Now, it's important for us to note that PGD programs for sex selection and genotype selections are not included in this program. They are separate programs, and if you want the cost for that, you will need to call the clinic for details. Now, I've mentioned that patients will receive a mail stating the type of program they are going to be embarking upon. I've talked about the cumulative pregnancy rates. Now, to increase your cumulative pregnancy rate, we strongly advise you to pick the treatment option that greatly increases your chance of success. Please, this is very, very important. We believe very strongly that for every patient that will register and go through this treatment program, that you will achieve success. And what is our goal? Our goal is a healthy baby and a healthy mother at the end of it all. And so we'll be guiding you in the choice of treatment option, but for us, our overriding the overriding factor that will determine what options we pick will be what is the chance of success. And lastly, all couples going through this program will be allowed, we allow the foundation to use their testimonies, baby photos, allow documentary on them as promotionals to encourage other couples trying to achieve conception. I know that some of us may have exceptions to this, but please let me explain this. This is a foundation that is bringing forth this program. This program is only made possible by the goodwill of partners who are committed to ensuring that we provide IVF at this rate, thus ensuring that many couples are able to access IVF treatment, which is what they need to achieve conception, to show and to ensure that other people are encouraged to join, because there are so many people who are skeptical about this IVF process. We have a lot of patients a lot of clients, couples, who don't believe that this is real. They think it's fake, it's a scam. We want to be able to have proof, testimonies. And I know that people are moved by what they see. The reason why most people come to us is because of our patients who have gotten successes, who have gotten results, and they are willing to tell others that, see, I got pregnant through IVF. Where did it happen? It happened at JFC. Go there, and you have your success also. So we've had a lot of testimonies like that. So we want to be able to use your testimonies. Like I often will say, why not turn your pain into gain? You waited for 15 years, for 18 years, for 20 years, and God has blessed you. Turn that pain that you went through into gain, so that those who have not achieved the success, who are still going through that journey, by your testimony, by your breakthrough, they will be encouraged to continue. And that is why we want to appeal to couples who will be signing up for this project to allow us to use their testimonies basically to encourage others. Okay, and that is why we have this put here. All right, so thank you very much. I will just quickly go through some very brief scenarios so that you understand what I mean when I talk about the additional costs that may be required. Now, this is a scenario of a 30-year-old with normal semen parameters. Now, the only additional cost that she will be making will be 65,000, which is for hormonal test, right? And if her BMI is fine, her ovarian reserve is good, 30-year-old, we expect her to have a normal ovarian reserve. We expect that with 150 standard dose, there should be no additional need for gonadotropin. Okay? The progesterone levels, if they are high, all right, we will freeze all our embryos and then we'll do a frozen transfer after 3 months. Okay, so for this particular patient who is 30, all right, the additional payment that is required for her is, like I said, is 65,000 only. And then after we have frozen the embryos and she gets pregnant from the embryo that was frozen and she has additional embryos stored with us, after 3 months, she'll be required to pay 10,000 every month. And of course, when she gets pregnant, luteal support 250 will be required. Okay? The second scenario is a 30-year-old with very poor semen parameters. Same age group, same profile for the woman. The only difference is that the husband has very poor semen parameters. The addition that will be made, all right, to what was done in the first scenario is the 100,000 that will be paid for ICSI. If this patient goes through an IVF process, meaning that you get the sperm, get the egg, put in a dish, and you allow the sperm to fertilize the egg, there will be no fertilization because the motility is very, very poor. So for such patients, there are not so many, but they do exist. For such patients, ICSI will be the best option, and then she'll be required to make that additional payment. All right, every other thing remains the same as the first. The additional payment that will be required will be 100,000. Now, the third scenario is 37-year-old lady with normal semen parameters. Now, for 37-year-old, the chance that we may need additional medication because of the reduced ovarian reserve is there. Once a woman gets to 35 and above, there's reduced ovarian reserve. And so the patient may require, I use the word may, she may not require, she may require additional gonadotropin. All right, and if that is required, then they will make between 50 and 250. Now 250 is the highest. Most patients may not require to make that payment. Of course, whatever you need is what you will pay for. Okay, and then every other thing would remain the same. If freezing is required, it is covered, and then after 3 months, you pay for storage. All right. Again, you'll be required to make 65,000 for hormonals, because for patients who are self means that they are going to be stimulated. It's important for us to know their ovarian reserve so that we can determine appropriately what dose of medication and be able to prognosticate what their chances are. And this will help us in our discussions in terms of treatment options. And then the fourth scenario is a 37-year-old with poor seminal fluid analysis. Again, the additional cost to that would be 100,000. Now, what we have done here, we have looked at the worst case scenario. So don't get scared by 405 as additional cost. We have put 240 as the additional cost for gonadotropin. That may not be required. All you may require may be 50,000 or 100,000. Okay. But I just put that there to tell you that medications can go so high. We can sometimes double the dose of medication that we started with. Okay. It's also important for us to know that for patients who are using their own eggs, they may also be required to use to get supplements to improve egg and sperm quality. These are all additional costs that will be borne. And then 45. Now this is the fourth scenario. A 45-year-old with normal semen parameters. Obviously, this will be an egg donation program. So the only additional cost that will be required for her is the payment of 200 for the egg donation program. And when she gets pregnant, then she'll be required to pay 250 for luteal support for 7 weeks. If the first transfer was not successful, then the patient will be required to pay only 200,000 for the second egg donation program. 200,000. That is what will be required. And then we have a 45-year-old with very poor semen parameters. In addition to the 200,000 that will be paid, she will be required to pay. They'll be required to pay an additional 100,000 for ICSI. Like I said before, once you have very poor semen parameters, then ICSI will be the best option to ensure that we optimize the chance of success. So total amount that will be required if you have a very poor semen parameters that require ICSI is 300. Okay. If, however, they are frozen, we have embryos that are frozen, no additional payment will be required. So thank you very much for your attention. Once again, let me apologize for the hiccups that we had. It was due to network failure. I promise that the next Zoom meeting that we will have, we will do better. So at this time, I'll be glad to take questions. So questions strictly on the chat. So I'll go to the chat.
When I went for this one, the one that you.
Okay, so we have some okay, so thank you very much. We'll just go through some questions very briefly. I may not be able to take all the questions that have been asked, but in our next Zoom meeting, we will look at the questions. Said after the online registration, I did not get any email confirmation from you, but I got a call from your representative. Okay, that is an automatic response. So please check your spam. Okay, it's possible it went to your bulk mail. The link for the online registration, please. It's on the website. Once you get to the Be Fruitful, in fact, the homepage, it has it on all the homepage. Register now. Once you click on that, it takes you to the project, and after you go through the information, The last item there is registration. Okay. Under terms and conditions, point number 4. Okay, I need to go back to that now. The point number 4 is that the 500,000 covers the 500 covers only standard dose of 150 IU for 12 days. I think I've explained that. What I mean is that for self patients who are going to be on stimulation, the standard dose is 150 IU. If, however, you do need to have additional, if we need to increase the dose, then you need to, that is not covered under this, the 500 that you've paid. You need to make additional payments. I think I have, okay, I've answered that. Okay. I have a private question. Okay. We will leave a number. Okay, so I have a private question. Okay, so I've been through the IVF process. Conditions are stable. I've been through the IVF process. The first failed, while the second was successful, but lost the pregnancy after 5 weeks in December 2020. Prior to the procedure, I had high prolactin. I'll be 36 by March. What do you advise? Thank you. So when you come for your fertility evaluation, we will evaluate you, and then we will give you, we will tell you what the best options would be. Please, what about patients with underlying issues like high BMI, diabetes? All of those things are issues that we need to handle. We need to ensure that they are properly controlled. Your blood pressure is well controlled, your diabetes is well controlled, because the IVF medications can also sometimes make this control quite difficult. So for patients who are hypertensive or diabetic or have a high BMI, we encourage you to lose weight. So in the time between when you've done your evaluation and you're waiting for your treatment to start, we will use all of that to ensure that these issues are taken care of. Please, can we get the slide? Yes, we can have the slide put. It will be on the website. How many embryos will be transferred on each cycle? We typically transfer 2, not more than 3 embryos. Okay, I've answered the same question. Can I get a video of this presentation so that I can share with my husband? Yes, the video will also be put on our website and on all our social media. What about a 50-year-old? Can she still try IVF? Very well, why not? She can. And she has a very high chance of getting pregnant. But you know that for a 50-year-old, it will be an egg donation program. How do you determine patients that will require egg donation if you don't do a hormonal assay? A 45-year-old woman who is coming to me, I don't need to do a hormonal assay to know that she will require an egg donor. What is most important is not the egg quantity, but the quality. And quality is age determined. And the truth is that for patients, once they are approaching 40, there is a significant reduction in the quality of the eggs. An egg, the age of the woman is the singular factor that determines success at IVF. So I don't necessarily have to do a hormonal assay to determine if a woman will require an egg donor or not. Like I said before, we are looking at the options that gives you the best chance of success. The 250 after pregnancy support, is it a must? Yes, it's a must. If not, you will miscarriage. So can the person decide to use egg donor at the point of egg collection where the patient cannot get enough? No, we will not. It's something that has to be planned. Does the patient with thick endometrial lining require hysteroscopy before IVF? The lining is due to PCOS. If it's not hyperplasia, I want to enroll for the program. Thick endometrium as a result of PCOS does not require hysteroscopy, except if there are other factors that we think is present. We know why there is the thick endometrium, because of the increased estrogen levels. Sir, a patient from Sokoto, please, what about the patient with PCOS and how PCOS relates to IVF? That we will also would manage. If after payment and not anything started yet, can I get, sorry, if after payment and not anything started yet, then I get pregnant, can someone take my place? No. Someone cannot take your place. If you pay today and tomorrow you are confirmed pregnant, it's either like we said, it is not refundable. When you have delivered and you want to come back to use your slots, it will be available, or you can donate it. Sir, will a 39-year-old woman need a donor egg, or will you advise she use her own egg? The truth of the matter is that, like I said before, age of the woman is the singular factor that determines success. A 39-year-old woman using her own eggs, the chances are reduced compared to if she decides to go for an egg donor. But again, we have to look at personal differences and preferences. But you will be counseled on what your chances are. I was placed on CoQ10, DHEA before the second cycle due to low ovarian reserve. Yes? Yes, so those are some of the supplements that patients are placed on to help to improve the quality and quantity of eggs. But I must say that this does not totally reverse the state of the egg. There's still that age factor that plays a significant role. If after payment, no, I think I've answered that question. I'd like you to host another Zoom meeting. Yes, we will host another Zoom meeting. This time, 7 p.m. next week, Monday, we'll be having another Zoom meeting for those who would have registered and were not part of this Zoom meeting. Can money be paid instrumentally? No, no. The 500 must be paid at once. So if you want to, you can gather it, and then once you have it, you pay it at once. Instrumental payment is not allowed. Do you have any help for surrogacy due to underlying medical issues? Yes, we do. Although surrogacy is not part of this program, but you can call the clinic and then we can you can come for a consultation on how we can help with that. I've heard ICSI has a higher success rate. Why not take the option of ICSI for everyone? But that is not true. Success rate for ICSI is the same with IVF for patients who can do either IVF or ICSI. And the reason why we prefer IVF, and for us, IVF has given us a very, very good success, is because we allow the sperm that is the best, that is the strongest, to fertilize the egg. The only condition in which ICSI has a better success rate is in patients with poor semen parameters. And that is why we say that for such patients, we will offer them ICSI. In the last paragraph of the terms and conditions, you ask patients to send in their baby pictures, or you go to them to do a documentary. Okay, yes, that is what we said, and I've explained to you why we need that, so that we can encourage others. We want to use your testimony. We want to use your success to be able to encourage others who believe that IVF is not real, that IVF is not true. There are so many couples out there who have not done IVF simply because they don't believe that it's a viable treatment option. So we want to be able to do this to encourage others. What is the chance of success? What is the chance of success for women with blocked fallopian tube with 41-year-old? Yeah, the chance is good. 41-year-old, I recommend that you use a donor. Awesome presentation. Thank you, Doc and JOJE Foundation. See you next week. Thank you very much. I've heard that more embryo transfer, the higher the chance. Why not transfer more than 3, especially for those with adenomyosis or endometriosis? Yes, the higher the number of embryos that are transferred, the more the success. But above 3, even for patients with adenomyosis or endometriosis, your chances are not significantly increased. Okay, and so that is why we do 3 as our maximum. If I don't meet up payment in March, when is the next batch for this program? Okay, so the first batch ends, the first phase ends on the 31st of March, and the second phase begins on the 1st of April. However, our desire is to ensure that for the 5 years that this program would run, we will maintain these rates, but it is not a promise. It is based on the financial commitment we get from our partners that will determine whether these rates will remain the same or if there will be an adjustment. All I can say is that for this first phase, this is the program, this is the rates that apply. For the second phase that starts on the 1st of April to the 30th of June, we will not be able to determine what the rates will be. But like I said before, it's our hope that the rates will remain the same. But that is, again, subject to the inflow we get from our partners. Doctor, please try and transfer 5 embryos. So if we transfer 5 embryos and 5 embryos implant, what will happen? Can I do my basic fertility investigations here in Lagos at a center chosen by you rather than coming to Abuja? Like I said before, it's not, we want to be able to do these things ourselves and take responsibility. And again, it's not just the investigations you are doing in that phase. You are doing your investigations, we are reviewing your results, we're discussing the options, we're doing a mock embryo transfer for you, and then we are giving you your medications. So there's a lot. So this program will be executed in 2, it will need you to come to Abuja twice. The first time when we go through that first phase, and the second time when you are doing your treatment, the main treatment. And based in Warri, what can you do to reduce my chance of traveling? Like I said before, it has to be twice. Because if we want to do it once, that we believe will reduce our chances of you succeeding. We want to be able to do a proper evaluation before you start your program. Okay, so, I think I've been able to answer all of them. Oh, there's some questions from Facebook. Okay, just to announce to us that we're also live on Facebook, and then we have some questions from Facebook. Okay. So, like I said before, patients with endometrial fluid, we will not do a transfer. We want to find out why she's having endometrial fluid, and then we will manage appropriately. One of the common reasons for endometrial fluid is if the patient has hydrosalpinx. If that is the case, then we will have to go in and clip and the fallopian tubes. So we will find out why she's having endometrial fluid and manage accordingly. What is the duration needed to start a new cycle after a failed IVF? It's on the terms and conditions, 3 months. After a failed IVF, 3 months is what is required. And under the terms and conditions, we say that after 4 months of your first program, if you have not done your second program, that cycle will expire. And the reason why we are doing this is so that, because so many patients will be registering and will be doing programs, we don't want to have people delaying their second program. And again, it's for your good, so that you take advantage of the cumulative success. Doctor, I'm 36. I was told I have cysts. Does that affect my eggs? Can I still use my eggs, or do I go for a donor? It depends. If the cyst has been a recurring one and in spite of medications used, drainage, the cyst keeps reoccurring, particularly if it's an endometrioma. Because of endometriosis, that could be a very great challenge, and then you may require an egg donor. But typically, for most patients that have cysts, once we give them, we treat once we treat them and the cyst resolve, then they can go ahead and use their egg. So it depends. So we will need to evaluate you and know what your ovarian reserve is, take the history and know for how long you've been having cysts and what has been the previous outcomes that you've had. That will help us decide whether we will use your eggs or if you will require an egg donor. All right, so thank you very much. I want to once again appreciate every one of you who joined us on this Zoom meeting. It's the first of many that will be coming up. There are many who have registered. Some have already begun to pay up. Like I said before, it's on a first come, first serve basis. 2 participants raised their hands. It's on a first come, first serve basis. Like we said before, from when you make your payment to when the main treatment program will start takes about 3 to 6 months. Like I said before, the registration and evaluation will start within 1 week. This is very important so that we'll be able to offer you adequate care in terms of a pre-IVF treatment. We have no doubt that this project will offer couples who have longed for an affordable IVF treatment. This program will run for 5 years. It will run in phases. And like I said before, whether the cost we have started with remains the same or not depends on the fundings that we get from our partners. However, I want to assure every one of you that you will receive excellent care. What we have promised is that by God's grace, you will at least 70% of patients who go through this program will get pregnant and by God's grace have a safe delivery and end their journey with smiles. Having gone through this experience, done 9 IVFs, and we have our set of twins through a 6-year period of treatment, I have no doubt that if a couple is committed with faith in God, that you also will have a sweet story to share. So on this note, I want to say thank you very much. I am most grateful to every one of you who tuned in. And we'll be having another session next week, Monday, by 7 p.m. for those who were not able to tune in. Like I said before, the slides will be on the website. The record of this Zoom meeting will also be on our website and on our social media handles. So thank you very much. I'm looking forward to seeing you in person when you come for your investigations or when we have the online consultation for those who are not based in Abuja. Like I said before, we're also going to be providing affordable accommodation because that has been one of the challenges that I know patients coming from outside Abuja would have. We're making plans to ensure that we're able to provide accommodation for you so that will not be a challenge. So thank you very much. Have a wonderful evening, and then God bless you. Should I stop the video?